Traveling is often seen as a joyful escape, but for people who are living with diabetes, it can bring some unique challenges that go far beyond just packing your bags or might something like booking your tickets. So, from managing the fluctuating blood sugar levels to adjusting meal timings and also handling medications on the go, even a short trip can feel overwhelming without the right planning. Also, the studies and research shows that people with diabetes face increased risk of dehydration, infection, and blood sugar imbalance with traveling, especially when the daily routine of their are get disturbed. The long journeys, irregular meals, and limited access to the medical support can silently increase this risk if not managed carefully. So, in this insightful session, Dr. Vishal Kastawar will share some practical strategies for the safe and enjoyable travel with diabetes, including how to prepare before you leave, manage a diet and medications, go and handle unexpected situations with confidence. So, here, Dr. Vishal Kastawar, a distinguished consultant diabetologist with an MBBS and MD, has been at the forefront of managing and treating diabetes with a holistic and patient centric approach. Practicing at Shri Deep Medical Care Center, Jabalpur, he brings extensive expertise in diabetes care with a strong focus on lifestyle management, prevention, and long term health outcomes. With his clinical proficiency and compassionate guidance, Dr. Kastawar emphasizes not only controlling your blood sugar levels but also addressing the broader challenges that people with diabetes face in their daily lives. So, in today's session, he will share some essential travel tips for the people with diabetes, from smart planning and medication safety to practical lifestyle strategies, ensuring that the journey remains safe, enjoyable, and worry free. So, doctor, before moving further, doctor, would you like to add something from your end?
Yeah, hi Princey and hi everybody there. We've been discussing about diabetes with our patients, with so many people, but we've been reading a lot also. I think diabetes patients, their family members try and know more and more about diabetes, but sometimes we are not prepared for the changed schedule system. When we travel, we go some places and we
Yes.
usually do not know how to pack our bags. We've seen a lot of diabetic patients who just go on their travel, take their medicines, but they miss out on a lot of things. So I think this topic that you presented today, how to travel with diabetes, is quite an interesting topic, and I think people will definitely start knowing more about diabetes and traveling with this topic. Thank you.
Yes, definitely, doctor. So, we'll start with the conversation. Doctor, my first question to you is what are the must carry essentials for someone with diabetes while traveling?
So basically, most of us, if you have diabetes, most of you would usually like to carry your medicines along. Let's say if you're going for 10 days, you may carry the medicines for 10 days or 12 days. What I would suggest is that you carry medicines for a bit more extra, for at least a week extra. So all your medicine that you're carrying should be taken for at least a week extra. Apart from this, I would always suggest that monitoring machine, glucose monitoring machine, strips, lancets, they should also be carried in an extra amount. You should carry, never travel with diabetes without your glucometer. Like you take your brush, you take your garments along, you take your spectacles along. Glucometer is that much more important for a diabetic patient, whether a patient is on insulin or not. Alongside, I would suggest that when you are taking insulin along, you should take some extra precautions when you are carrying insulin. A cool pouch may be one of the more important things than, let's say, something else. Then carry some snacks, some glucose tablets, some candies, some biscuits, some fruits. Let's say somehow you are not able to get a proper meal, or let's say somehow you are not getting the meal of your choice, or maybe the meal is delayed. Then you can take these tablets, these things, which can actually prevent you from developing hypoglycemia. Apart from this, a medical ID is definitely very important. We have seen patients falling unconscious and not knowing, and nobody knows what to do. Some people have even suffered
Yes.
CPR also. Just they fell unconscious and someone started doing a CPR. That's not a good idea. You should always keep a medical ID, maybe in your purse, maybe a bracelet kind of thing, saying that I am a diabetic and I may develop hypoglycemias, and I may require some glucose toffees or some fruit juices if I am not able to talk or I become unconscious. So those things have to be carried along. Diabetes traveling is like traveling with an emergency kit. If you have an emergency kit, you don't use it, that's well and fine. That's well and good. But emergency kit should always be there with you. That makes you safe.
Yes, thank you so much, doctor. Yes. So, doctor, you have just mentioned about the irregular meal or the meal timing that it get delayed regularly or some
Right.
while in the trips, right? So, can you please highlight more on us that how people with diabetes can manage this irregular meal timing on
So I may
trips?
suggest that you may carry along with you some nuts, some roasted chanas, some protein bars, some fruits that can be carried, and these things can be taken when there is an increased gap in your meal. So, and sometimes,
Okay.
you may not like to eat some food. Maybe you are in a place where, let's say, a vegetarian person does not want to eat food in a place which where non-veg is being taken. So what I would suggest is, don't skip the meal entirely. Take a small amount of the meal. Don't take a large amount, but then don't skip it entirely. Also, if you are, let's say, on insulin, or let's say if you are using drugs which can cause hypoglycemia, then it becomes much more important. And if, let's say, you are not eating for whatever reasons, then avoid medicine also. Hypoglycemia is far more dangerous than developing hyperglycemia for a short period of time. Along with it, hydration is extremely important. Keep on sipping, keep on drinking small amount of
Yes.
water multiple times. Traveling can mean irregular meals, but your diabetes will never like surprises. Even if you can't eat a full stomach, eat small amount multiple times. That's very important, and that's the key.
Thank you so much, doctor. I guess this information is very helpful for everyone, like who are not with the diabetes. They are normal people and also can manage their some meals with this kind of
Yeah.
things, right? Also, doctor, if we see some from the point of view of medications and packing our bags while going on trips, so doctor, what is the safest way to carry and store the insulin or medications during the
Yeah,
long
that's, I
journey?
think, a very important question again. I've seen people traveling with insulin, and they'll keep insulin in car, in the dashboard. And sometimes, you keep insulin in the luggage, in air, in the when traveling in air, in the plane, you may keep it in the luggage, in checked in luggage. So, in the airplane, in checked in luggage area, it can be freezing cold, and your insulin may not work at all later on. Also, when you are traveling in a car, if you keep the insulin in the dashboard, then the dashboard can be very hot because it is closer to the machine, then the insulin again will not work. So it is very important that while traveling in air, you keep insulin in the hand baggage. While traveling in car, you keep it alongside in your seat or in the back side of the car rather than in the front of the car. Insulin should always be avoided to have direct sunlight. You should avoid keeping insulin in kitchen area where it is hot. You should always try and keep a gel ice pack or an insulated pouch where the temperature outside may not affect insulin. Insulin that will be used in the next 28 days, can be kept at a temperature of up to 28 degrees centigrade. So it's not necessary that you keep the insulin all the time in the fridge. While traveling, if you are using insulin vial or pen, and you are going to use it within the next 28 days, you can keep it in your shirt also. But the temperature of the area where you are traveling, or the temperature where insulin is kept, should not be more than 28 or 30 degrees centigrade. That is the only precaution that you take. And insulin which has to be used after 30 days. For that insulin, you have to try and maintain temperature between 4 to 8 degrees centigrade. That is important. People who travel long
Okay.
distances, maybe you are going to UK, maybe you are going to US, and you'll be staying there for 3 months. For the insulin that you'll be using the first month, that can be kept at a temperature up to 28, and the insulin that you are using after the first month has to be maintained in a temperature of 2 to 8 degrees centigrade. Again, it should not be frozen.
Degree centigrade.
So If you are
Yes.
carrying an insulin in, let's say, a thermos, don't put ice in the thermos. Ice is a temperature less than 0 degree centigrade. The thermos in the inside of the temperature will be less than 0 degree. So it will destroy the insulin. Keep a gel pouch from your freezer, the lower compartment, not the refrigerator, and keep that gel pouch inside the thermos that you are using, so that the temperature inside the thermos remains between 2 to 8 degrees centigrade, and that insulin you can use till expiry date. Insulin is actually like a baby.
Okay.
You don't have to
Yes.
make it too hot, don't make it too cold, and keep it with you alongside. That's it.
Okay. Thank you so much, Doctor. So, Doctor, our audience wanted to know that how can a traveler or a patient with diabetes can prevent the sudden sugar spike or the drops while on the go?
First of all, I would say is the meal planning. You don't fill your stomach too much that you are not able to eat in the next 6 to 7 hours again. Take small meals, take balanced meals, avoid delaying, and avoid taking too much of carbohydrates. Keep glucose tablets with you, try to keep juices with you. Let's say if you develop symptoms suggestive of hypoglycemia, even if you have not documented hypoglycemia, you can consider it as a hypoglycemia rather than considering as hyperglycemia. Take that. And let's say if you have the possibility of checking is always better. Again, don't sit for very long hours. Keep moving. Otherwise, sitting for long hours, let's say in airplane, if you are sitting for, let's say, 6 hours, 8 hours, let's say in a car you are sitting for 6 to 8 hours constantly, that can raise the blood sugar levels. Try moving. In car you can stop every 2 hours, you can move up for 5 to 10 minutes and then again sit in the car. In airplane always you can take short breaks of moving. Again, while eating, avoid high carbohydrates. Take small amount of carbohydrates and mix it with salads, fibers, dals, and proteins rather than taking large amount of carbohydrates. Sugar or diabetes always loves balance. Small portions, frequent checks, and keep walking intermittently. That will take you a very long distance and that will make your travel convenient, easy, and happier also.
Okay. So, Doctor, as the food, the main character of maybe many of the people comes in this picture now. So, the next question is related to that only. That can people with diabetes enjoy the local foods and still keep their blood sugar in check?
Yeah, that is again another question because our minds will always love food which has more of carbohydrates. So local foods, if they you are taking and it contains more of carbohydrates, that may not be good for your sugar levels. So what I would suggest is, if you want to enjoy local foods, enjoy, but enjoy in moderation. That is, taste comes from small portion, fullness comes later on. So go more for taste. You take small portion of the food that you wish to enjoy, mix it with more of fibers, again like salads, fruits. You can take dals, curds, and then you take carbohydrates. Try beginning your meal with more of things like salads, dry fruits, badam, pista, makhana you can take, and then take your food. So whatever you have taken first will get absorbed first. So let's say you begin with rice or roti, or maybe you begin with some sweets that will be absorbed first, and that will raise the sugar suddenly. You begin with salads, salad goes first, and then you take sweets. The sweet will get absorbed slowly. That is important. You can always enjoy, but then enjoying with more of discipline will help you go longer way to enjoy more duration of time.
Yes, definitely, Doctor. Thank you so much, Doctor. So, these were the questions all I have for you. Is there any take home message from your side for our audience?
Take home message is same. You have to travel. You can travel, you can enjoy travel, but if you are diabetic, give some additional time to a proper preparation. Don't forget your glucometer, don't forget your snacks, don't forget your meals, don't forget your walking while traveling. With all this, you can enjoy a lot.
Thank you so much, Doctor, for this beautiful session. So, as we conclude today's session on the travel tips for people who are living with the diabetes, A heartfelt thank to Dr. Vishal Kastawar for sharing his expert views and insight on such an important topic. His practical guidance has shed more light on that how carefully the planning, some smart food choices, and mindful medications managed can make the traveling safe and also the enjoyable for the people who are living with diabetes. Also, to our wonderful audience, thank you for being a part of this important conversation. We hope this session or the discussion has empowered you to embrace travel with the confidence, whether it's by preparing your essentials, managing your meals, and staying alert to your body signals on the go. So just stay connected with us for more sessions like this, featuring trusted experts and meaningful conversations. Until then, take care of your health, enjoy your journey, and don't forget to follow us on social media handles for more diabetes care and wellness tips. Dr. Vishal, thank you so much once again for joining with us and sharing your practical knowledge with us.
Thank you. Jai Hind.
Yes.